My name is Dr. Shaun Matthews. I'm an oral and maxillofacial surgeon. I'm also director of the Indiana University School of Dentistry, TMJ Institute. As an oral and maxillofacial surgeon, I developed a specific interest in TMJ surgery over many years, and that is where my expertise lies. I'm proud to be associated with the Institute, and certainly as far as the surgical input that I provide is concerned, I recognize that as a surgeon, my line of work should always come at the end of the road and very rarely at the beginning of the road. TMJ patients, first of all, should be subjected to non-surgical treatment, and that's where other colleagues who are part of our team come into play. And that small cohort of patients who do not respond to non-surgical, that is conservative treatment, may then go on to undergo some form of surgery in my hands. The various surgical procedures that I have in my toolbox really start from the minimally invasive, that is what's called an arthrocentesis or a jaw joint washout procedure with a couple of small needles, and that can help up to 70% of patients. Then we upscale it to an arthroscopy, a TMJ arthroscopy procedure, where we put a small telescope into the joint, which has a little light source on the end that allows us to visualize the internal anatomy of the joint and also undertake therapeutic procedures at the same time. And then if they fail to bring about any improvement in the patient's symptoms, I then crank it up the next notch to a formal open joint procedure, where I'm physically picking up a surgical scalpel and effecting some kind of procedure in that patient's jaw joint. The procedure of choice depends on what the patient's pathology may be. And finally, at the very extreme end of the spectrum are those patients that may undergo a total joint replacement. What that means is an artificial jaw joint replacement. In the same way that patients have artificial hip joints and knee joints, we can now also give them artificial jaw joints. And that's at the end of the road if all else has failed. That's another area of interest and expertise of mine. So I'm pleased to say that over many years, that practice of mine has grown enormously. And here at the IUSD TMJ Institute, it is a privilege and a spectrum of work that we can offer to patients if it's determined to be necessary. Thank you.